Morning, our patient is 7 years of age from San Juan, La Union, scheduled for laparoscopic cholecystectomy. Site is the upper right part of your abdomen. Consent for the surgery and general anesthesia injection was secured and signed by the patient.
Excuse me, doctors and nurses, ready for signing.
Good morning, our patient is Mr. Kenrick 7 years of age from San Juan, La Union, scheduled for laparoscopic cholecystectomy. Site is the upper right part of your abdomen. Consent for the surgery and general anesthesia injection was secured and signed by the patient.
Dr. Ramos, is the site marked?
Yes, the anesthesia safety check and complete.
The pulse oximeter on the patient is connected and functioning.
Any known allergy?
The patient has no known allergy.
Is there an airway difficulty or risk for aspiration?
No airway difficulty and no risk as.
Dr. Ramos, is there a risk for 500 ml blood loss?
There is no concern.
Just take the check complete. Excuse me, doctors and nurses, ready for timeout.
Surgical team members, please introduce yourself by name and by role.
I'm Nurse James Garringo, the circulating nurse.
I am Adam Biteng. I am a surgeon.
I am Dr. Gabriela Ramos and I am a specialist.
My name is Aldwin Orejudos and I am the scrub nurse for this operation.
Can you verbally confirm the patient's name, the site, and the procedure?
The patient's name is and the site is in the upper right of your abdomen, and the procedure is laparoscopic cholecystectomy.
Dr. Ramos, what are the critical or unexpected steps, operative duration, and anticipate blood loss?
Critical steps: possibility for open conversion to open surgery with a duration of 1 to 2 hours and a minimal risk for blood loss.
Are there any patient-specific concerns?
There is no concern.
Sir Aldwin, has his sterility been confirmed? Are there any equipment issues or concerns?
Upon checking the equipment, sterility has been confirmed and there are no present issues or problems regarding the equipment.
Has antibiotic been given?
Yes, augmented started.
X-ray, CT scan, MRI films displayed, especially for cranio and ortho.
It is not necessary for this case.
Okay, thank you, doctors and nurses.
Excuse me, doctor and nurses, ready for sign out.
The procedure is laparoscopic cholecystectomy. Is that correct?
Yes, that's right.
All instruments, sponges, and needles are complete and counted.
The specimen label gallbladder with the patient's name. Is that right?
Yes, that's right.
Dr. Biteng and Dr. Ramos, are there any equipment problems to be addressed?
The scissors, get the scissors. The scissors is not sharp enough. We want report it, please.
Noted, doc.
Dr. Biteng and Dr. Ramos and Nurse Aldwin, are there any concerns for the recovery or management of the patient?
So far, there are no concerns about the management and care about the patient.
Thank you, doctors and nurses. Sign out complete.